Hello again, and welcome to the kickoff of the virtual Iowa Governor's Conference on Public Health. We're so glad that you've decided to join us today and spend the next 90 minutes learning about what it means to be vulnerable in the face of today's public health issues, coronavirus, everything else, and what it means to rehumanize the workplace, especially now when our workplace and our home life are merging into one more than any of us probably planned on it being. As you know, we usually meet in person to share best practices and lessons learned from colleagues across the state, but like everyone, coronavirus has caused us a pivot. But we are not forgoing our commitment to learning and growing, and we are so glad you're here today. My name is Lena Tucker-Reinders, and I'm the Executive Director of Iowa Public Health Association, and IPHA and Iowa Environmental Health Association are the primary co-planners of the Iowa Governor's Conference on Public Health, so again, welcome. I am grateful to have you join us today for the keynote presentation by Dr. Rosie Ward, and I hope that you'll continue to meet with us over the next 2.5 weeks to support our public health colleagues around the state. A note on CEUs, we are working with providers of continuing education credits in nursing, CHES, dietetics, and dentistry to make sure that you all can receive CEUs for attending these sessions. If you are wanting CEUs for today's keynote, please do type your name in the chat box and which type of CEU you are looking for, and we will be sure to follow up. There will be an evaluation form that you need to fill out after the keynote presentation. We'll make sure that you get that. I also want to thank our sponsors and exhibitors of the virtual Governor's Conference. Their commitment to public health is paramount, especially in these times. The sponsors of the virtual conference are Aetna, AmeriGroup, Unity Point Health, and the University of Iowa College of Public Health. You'll find a list of the virtual exhibitors on the IGCPH website at iowapha.org. The College of Public Health and Unity Point Health in particular are sponsoring today's keynote speaker, Dr. Rosie Ward. I'd like to give them each a couple of minutes to share with you what inspires them to support the Governor's Conference and public health in Iowa. So with that, I'll turn it over to Lori Walkner, who is with the College of Public Health and the Midwestern Public Health Training Center. Lori?
Thank you, Lena. The University of Iowa College of Public Health is very pleased to sponsor the Iowa Governor's Conference on Public Health. And our sponsorship is an indication of the importance of Iowa's public health workforce and the need for our workforce to be well-trained and ready to face the challenges of today and the future. It's part of our commitment to our students and the importance of giving them access to real-world experiences and the opportunity to present their research and learn from professionals working in this field. And it's part of our dedication to collaboration with community partners who are the backbone of any effort to engage with Iowans to improve health in our state. Most importantly, though, we're pleased to sponsor this conference because public health is at such a critical juncture right now. And the work we do is so essential to our common success and our common future. It's safe to say that public health people have always felt this way, but the COVID-19 pandemic has raised the stakes and brought the significance of our work into very clear focus in a way that's possibly nothing like ever has been before. So although this year's conference is taking place under very unusual circumstances, and we're not able to get together in person as we would like to, we've never been more proud to be part of Iowa's public health community. Thank you to the organizers of that conference for all you've done to ensure that we can continue to connect with each other and share our experiences so that we can learn and move forward together towards a better, healthier future for all Iowans. Thank you very much, and special thanks to our frontline workers. Back to you, Lena.
Thank you, Lori, and thank you to the College of Public Health. You are a valued partner, both the College of Public Health and the Training Center, and we are grateful for your support. I'll now turn it over to Dr. Jeremy Whitaker, who's with Unity Point Health and Allen College.
Thank you, both Lena and Lori. Again, I'm Dr. Jeremy Whitaker, this year's Governor's Conference co-chair and president-elect of the Iowa Public Health Association. It is a privilege to introduce my employer, Unity Point Health, as one of the sponsors of today's keynote address. As many of you know, Unity Point is one of the largest healthcare systems in the upper Midwest, Over 32,000 employees span 25 hospitals, hundreds of clinics, and 4 health science colleges in Iowa, Wisconsin, and Illinois. My home base, Allen College, is home to the second largest BSN program in the state, behind the University of Iowa, and has graduate and undergraduate programs in nursing, occupational therapy, lab science, medical imaging, public health, and in 2021, a doctor of physical therapy program. And without further ado, I'd like to introduce our keynote speaker. Dr. Rosie Ward is a fierce advocate for humanity who is sought after to help rehumanize workplaces that free, fuel, and inspire people to bring their best selves to work and home each day. She serves as CEO and co-founder of Salvio Partners, a professional consulting and training company focused on equipping organizations to find success while putting people back at the forefront of their business. She consults with organizations of all sizes and industries and coaches and develops people so they can break past barriers, step into their greatness, and show up as a leader in all areas of their lives. Her new book, Rehumanizing the Workplace, serves as a blueprint for navigating disruption and creating a sustainable future. It has consistently been in the top 5 workplace behavior books and top 10 business leadership books on Amazon since its release last month. Rosie lives in Minneapolis with her husband and her son. And with that, I'll give it over to her.
Awesome. Thank you so much, Jeremy and Lena and Lori, for having me, and thank you to everybody for being here. Certainly a little different for me to be sitting in my office in Minneapolis where it's snowing outside than being with all of you in person, but appreciating the pivot and being able to be with all of you. So with that, I know that I'm going to be presenting. I'm going to ask you to be typing some stuff in the chat box, and I know that we have plenty of time for Q&A at the end. So I'm looking forward to beginning. So with that, I'd like to start today by just asking you to humor me and close your eyes, assuming you're not driving or anything. And just close your eyes and take a deep breath. And I want you to imagine that you have been given a magic potion. And this magic potion is one that allows you to have the power to dramatically transform workplaces and communities, and transform them from ones that maybe there was some scarcity mindset and stinginess and people keeping themselves small or maybe not collaborating as well as they could be, to one of energy and hope, and where people can break past their own barriers and step into their greatness, where everybody is showing up as a leader towards a common good. And just imagine if you had that kind of potion that could just let that experience happen, how different our communities and how different our workplaces would be. And what I want to suggest to you today is that this isn't witchcraft. This isn't science fiction, that maybe it's not magic, but there is a potion, if you will, that can allow this to be a reality. And that's what I want to bring us into today of how do we actually do that, make it from seeming like it's fiction to something that is really, truly achievable and tangible, and why it's needed. And so with that, I want to start with a question. And so what I'm going to do is ask you to type your response into the chat box. And the response to this question, and let me tee it up for a minute. So researcher and best-selling author Brene Brown spent 7 years doing research with organizations and leadership and really looking at what is required and what is the difference of those that are thriving and are set up for a sustainable future versus those that are struggling. And she asked them, these leaders, C-suite leaders, well over hundreds of them, this question, really, what is the future of leadership? What, in other words, like, who's still going to be standing in 5 years? What is it that our future is demanding of us might be another way to think about this. So what I'm going to ask you to do right now is, I believe the chat box is enabled, is ask you to type in the chat box what you think their almost unanimous response was to this. So what are we needing from the future of leadership? So I'll give you a minute to type your guesses in the chat box. And let's see if I can see. So again, what are your guesses in the chat box to what these leaders said of what's the future of leadership and what are people needing, or who's going to still be here in 5 years. All right. So I'm unable to see the chat box. So hopefully you type your responses, but I'm going to give you the answer for those of you. A lot of times the common responses that I will see are we need adaptability, we need flexibility, we need listening skills, and those are all part of it. But what almost unanimously said, we need braver leaders and courageous cultures. So think about that for a second. I feel like not only was this true then, but it's almost even more true today, that who is still going to be thriving on the other side of this pandemic? What is life going to look like for organizations? We have to have braver leaders and courageous cultures. So I want to look at what do we mean by braver leaders and what do we mean by courage? So let's start with leadership. This is how we define leadership in our new book, that leadership is ultimately about us maximizing our positive impact on the world by becoming our best, fully authentic selves, and then supporting those around us to break past barriers and step into their greatness. This is what leadership fundamentally is. This means that every single one of us has an opportunity to show up as a leader, because it requires us to be brave to, first of all, show up as our fully authentic selves. It requires us to be brave to support others, to break past their barriers. And this is really how I want us to think about leadership today, and not thinking about it in terms of power or authority, but really in terms of how are we showing up. And we are seeing people show up tremendously as leaders during this time, and we are seeing people not show up as leaders. And when we think about courage, right? So we need braver leaders and courageous cultures. Well, what is courage? Courage is showing up to be fully seen when we can't control the outcome. When we are exposed to uncertainty, risk, and emotional exposure. And the definition of uncertainty, risk, and emotional exposure is being vulnerable. A lot of people think vulnerability is disclosing everything. That's not vulnerability. Or people will say, I was raised to believe vulnerability is a weakness. But vulnerability is when we are exposed to uncertainty, which is everything that's happening right now. We are extremely vulnerable in multiple facets. We are exposed to huge risk in a whole bunch of ways. And there's a lot of emotional exposure going on right now. And think about one example of someone who is courageous that didn't involve these three things. And what happens is, think about when we are vulnerable, it's kind of like a gladiator stepping into this arena of life. You've got people who want to judge you and, are sitting there lobbing insults, or easy to just assume all kinds of things about what you're doing. You're showing up for battle and you don't know what the outcome is going to be. And what happens, if you think of any gladiator movie or old time movie, when we enter into this arena where there's uncertainty, risk, and emotional exposure, what do? We armor up. So in the olden days, they literally put on armor to protect themselves, but we do this as human beings. We armor up and start to assemble our masks and things that help us feel safe, right? That help us find some level of certainty, that help us feel less at risk, that help us feel less exposed. But what happens is, while it might help us feel safe, it keeps us incredibly small. And it keeps us from being able to show up as a leader and really meet the demands that the world is asking of us. And so when we think about what are some of these barriers to courage, when we don't want to show up without our armor, we don't want to show up fully, when it's having to have tough conversations. I mean, there's a lot of those that have to go on right now. There's a lot of fears and feelings that get in our way. There's a lot of needing things to be perfect that gets in our way. We have this tendency or this bias to want to jump into action and solve problems rather than thinking things through. We aren't able to innovate. There's all kinds of things that get in our way of being courageous. And so really what I want us to think about today is, how do we create braver leaders and more courageous cultures? Because that is what our future is demanding of it. And if this pandemic has shown us anything, it's elevated that need even more so. And so this anchors on this premise that we are living and working in a VUCA world: volatile, uncertain, complex, and ambiguous. And COVID-19 has basically shown us VUCA to the extreme. We are living and working in a world where disruption is the new normal. And hopefully it's not as disruptive as this pandemic is, but disruption was happening long before that. And disruption can bring good things. It can bring evolution and new technologies and new ways of doing things. But it also triggers us, because that uncertainty triggers us to want to self-protect. We don't like those feelings of discomfort. As human beings, we are hardwired to seek out familiarity and certainty. And so what happens is we start clinging tightly to what is familiar, to what helps us feel safe. We start clinging tighter to our armor, and it has a whole host of unintended consequences. And so we need to just be aware that while the world is demanding that we embrace discomfort and we embrace disruption, the human condition wants the opposite almost. And how do we reconcile that difference? And we can reconcile that difference. And so I want to anchor this on one more concept before we get into how do we navigate these waters. Some of you might already be familiar with this, but this is great work that comes from Marty Linsky and Ronald Heifetz out of Harvard. And they've looked at two different types of challenges that we face individually as human beings and as collective entities made up of human beings, so families, teams, organizations, etc. The first is a technical challenge. Technical challenges, we've been there before. There is a known solution. We can use standard operating procedures, checklists, tried and true. We can look at what we've done before and pretty much apply that template here, and it's going to work. And in technical challenges, we can use existing thinking and knowledge and resources to navigate that, and we're going to have a fairly good opportunity to have a successful outcome. Then there's this whole other type of challenge we face called an adaptive challenge, where there is no known solution. We are in uncharted territory, uncharted waters. And one of the ways you know you're dealing with an adaptive challenge is that it invokes a sense of discomfort, because it forces us to let go of what we know, of what has allowed us to be successful, and letting go of that invokes a sense of loss, and it creates discomfort. So we have almost this visceral reaction or uncertainty. Let me give you an example outside of the COVID pandemic. So this is a request I get a lot. Can you come in and do a workshop or do some work with our team? They need to be better at having difficult conversations. And there are many, many great trainings out there and templates and tools and resources that have conversation starters and checklists and things that you can use to help you have difficult conversations. And if that's really a technical challenge for your team or for your people, all they would need are the tools, conversation starters, the little tune-up of skills and training, and they would be able to be off and running and having those conversations effectively. But if the thought of actually having to use those tools and have that conversation makes people uncomfortable and want to throw up in their garbage can, you're not dealing with a technical challenge. You're dealing with an adaptive challenge. Adaptive challenges force us to change our hearts and our minds, not just our preferences or our habits. And this COVID pandemic, we have not been here before. This is completely adaptive. Can we use some of our thinking, knowledge, and skills to help us? Yes, but we can't rely on it because it's not like anything we've done before. And what happens too often with adaptive challenges is, yes, there's technical components that we can learn and skills we can grow, but the overwhelming piece of navigating adaptive challenges forces us to change our mindset, forces us to think differently. And that invokes discomfort. And so what happens is we start reaching for technical fixes, technical solutions that we think will help, but that's not what we need. It's a mismatched solution. And so we end up playing this really bad game of whack-a-mole. And what we need is to completely pivot and to completely adapt and look at things differently. And what I would suggest is that even before COVID-19, we were in a state of incredible adaptive change and adaptive challenges. Our VUCA world, by definition, throws us into an incredible space of adaptive challenge and adaptive change. And COVID is completely adaptive. We need to be able to pivot real time and navigate that discomfort. And Heifetz and Linsky put it really well when they said the single biggest failure of leadership is treating adaptive challenges like technical problems. So we have to understand what type of challenges that we are facing individually and collectively, and then making sure that we are aligning our solutions in a way that makes sense, that we're not reaching for technical fixes when what we need is to rally our resourcefulness, shift our mindset, and really look at things in a different new way to meet the needs that the adaptive challenge is asking of us. And so enter COVID, right? This threw us all for a loop. Yes, we've dealt with outbreaks before. I remember when I worked in local public health, we were preparing for bioterrorism attacks and other things. Yes, we've dealt with public health crises. Yes, we've dealt with national emergencies, but nothing like this on a global scale. And the good thing is that it almost has a unifying effect, right? Because we really are all in this together. The unfortunate is we are all in this together, and you have broad spread fear and anxiety and panic and invitations to armor up, and you've got the world basically shutting down and closing around us and people trying to navigate. I mean, my son's in the next room, right, doing his e-learning with his dad, and we're trying to figure out this new normal and how long is it going to last, and many of us are trying to experience our own shift in reality while trying to support others. And so we can work through this adaptive change if we use some tried and true principles of how do we navigate the waters of adaptive challenges and how do we come through this better. What we have to be aware of that will get in our way, and one of those barriers to courage or barriers to being able to navigate the waters of adaptive change, is a mindset that is pervasive during times like this. The Arbinger Institute refers to this as an inward mindset. And basically, here's what happens. Here's me, or here's you. And our vantage point when we are operating from the self-protected, armored, inward mindset is all about how are other people, the government, the virus, the economy, my coworker, my neighbor, fill in the blank, how are all of these stakeholders around me impacting me? And that could be me personally, it could be my family, it could be my team, it could be my employer, but we start to have this vantage point of how all of these other people are impacting me. And really, it's looking at, I have needs that I'm trying to get met, I have objectives I'm trying to move forward, and I have challenges I'm facing. And so we look at them from the context of, are they helping me get my needs met? Are they helping me further my objectives, or are they a barrier to me, right? And when we're in this inward mindset, we kind of forget that other people are just as important as we are. We think our needs, objectives, and challenges are more important than them. And we actually stop seeing people as human beings, and we start seeing them as objects. If they can help us further our needs, objectives, and address our challenges, we view them as vehicles. So think about if it's a vehicle, my vantage point is, how can I get you to help me do this? And I don't care that you have your own stuff going on. It's all about kind of me right now. If I think you're going to get in my way or be a barrier or a roadblock, I view you as an obstacle that needs to be removed and handled, right? So I might treat you a different way. And if you're inconsequential to me, you're irrelevant. And what I'm seeing happening left and right is that people are showing up with this inward mindset, this judgmental scarcity mindset, and it's all about them, when what we need is for people to really have a different mindset. And so just being aware that the inherent characteristics of this pandemic we're in are inviting more and more and more armor, more and more inward mindset. And if we can recognize it in ourselves and recognize it in other people, there's an opportunity to choose a different path. But think about this way, when we add in a perfect storm of the VUCA world inherently triggering a whole lot of adaptive challenges, triggering armor, triggering an inward mindset, and now you add a whole bunch of us together in a family, in a community, in a team, in an organization, and you have this perfect storm that leads to dehumanization and a lot of unintended consequences. And even before COVID, our workplaces were becoming increasingly dehumanized. 7 out of 8 of people in America prior to this went home every day feeling like they worked for an organization that didn't care for them. And I feel like how we show up during times of crisis speaks volumes of who we are as a person, but also as an organization. And you are seeing organizations that were already kind of dehumanized, digging in and showing their true colors even more during this. And what's sad is we know that when we work in these environments where we don't feel cared for, that there's already heightened depression and anxiety and sleep disturbances and all kinds of physical and emotional well-being ramifications that happen. And then you take a crisis like this and it just exacerbates it even more. Jeffrey Pfeffer has done some great research and has found that these toxic, dehumanized workplaces are literally killing us. In the United States alone, they account for almost 8% of our healthcare spend, and they're the 5th leading cause of death, but we don't talk about that. We talk about all the other illnesses and things, but we forget how much the workplace impacts us. And globally, it's not much better. And so I want to take this from the numbers to human for a moment and share with you my own experience, my own story, and why I'm so passionate about this. So once upon a time, many, many years ago, I worked for a consulting firm. And I was very fortunate that they were this local regional firm, and they let me play. They said, we don't really quite get what you do, but we get that culture and leadership are important and well-being is just one piece of it. And I had forward-thinking clients that let me kind of try out what worked and what didn't work. They embraced people challenging the status quo. They prided themselves in it. And I was able to grow my area and revenue, fulfilled in my work, probably worked way too many hours, but really from a work standpoint, was really, really thriving. And I found out what really mattered more than anything. And we're seeing that in times right now when we realize when we need our workplace to be human. So this is my son, Peyton, when he was about 8 months old. And he had been sick for a couple days with a pretty high fever. So if any of you've had sick kids, you kind of feel helpless, and he'd been crying. And so I hadn't been sleeping, and I hadn't slept in good 24, 36 hours. And my husband looked at me, his name is Dave, and he said, Rosie, you're exhausted. You need to go get some sleep. And I was like, no, you have to go to work tomorrow. He said, you need to go get sleep. And I don't know if you've ever been that tired, but you're just almost incoherent and out of it. And so I went upstairs and I crashed, and I don't think that I was even asleep 20 minutes. And I get woken up in this foggy haze by Dave screaming, Rosie, get up, call 911. And I'm like, huh? And I look, and he's holding our limp, lifeless looking baby. And I'm half out of it. I'm freaked out. I don't even know what's going on. I call 911, start putting stuff in a bag. I call my sister who lives 2 miles away, and I could barely get through hysterical crying. And I'm like, Peyton, 911, get over here. And I don't know if it was 5 minutes or 10 minutes, but it was the longest period of time in my entire life waiting for the ambulance to get there. And I remember hearing them when they showed up, overhearing someone say, we have a possible DOA. And many of you probably know what that means, but that's dead on arrival. He wasn't dead on arrival, but it was pretty sad. Now imagine something like this happening literally almost every 30 days. And it was almost like clockwork. And he would get these random illnesses that had nothing to do with anything, these fevers that would last 4 or 5 days, that we couldn't even get them below 103 with fever reducing medicine. We would lay him between us in the middle of the night and take turns not sleeping, watching him, thinking maybe one of us could help him in case he stopped breathing and was going to die in the middle of the night. We were stressed. We were on edge. We were both negative in our PTO balances at work. And on more than one occasion, we looked at each other and said, this is how people lose their jobs. What in the world are we going to do? We had him in and out of every specialist known to mankind, trying to figure out what was wrong with him, and trying to work and trying to not get fired and all of these things. And what did my organization do at the time? Well, they wrapped their arms around me basically and loved me and said, Rosie, we're here for you. And every time one of these episodes happened, I would get calls and emails and texts saying, how are you? How's Peyton? How's Dave? Don't worry about it, right? They would let me take care of what I needed to take care of. And you know what? It was worth more than anything to me that I could take care of what I needed to during that time. And in between these episodes, I still managed to grow my area and revenue, have extremely happy clients because they let me take care of what was important to me. And think about what's happening now. Are we letting people, knowing they're struggling, that they're trying to homeschool and they're juggling multiple priorities? Are we supporting people in this new reality and navigating this because it's incredibly stressful? But here's the thing, is that human workplaces take attention and intention, and they can slip away from you very quickly. And unfortunately, this humanity that my workplace exhibited didn't last. They joined a larger national firm, and where being unique and challenging the status quo and being human and tending to your family and well-being was once celebrated, it now became a liability. And you were just a number, and they wanted you to fit in this nice, neat little box. And anybody who knows me, that's not how I roll. And it was unsettling to them. And for the first time, and the only time ever in my career, I got put on a performance improvement plan because I was bringing in too much quote unquote Rosie related revenue, which I still don't really understand that to this day. I just think they didn't like me challenging the status quo. And I went from being my boss's golden child to metaphorically being shit on the bottom of his shoe. I was getting my hand slapped every time I turned around when I met the requirement of that first performance improvement plan. That pissed him off, and I actually got put on a second one with nothing measurable. And I remember saying to my boss, what is this? And there's nothing measurable in here. And it was just really, really evident that I was kind of being ushered out the door. Mind you, while all this is going on, we're still dealing with Peyton's health issues. We're still in and out of specialists. So I was a walking stress ball. I would walk into the office, and if I saw my boss's light on, my heart would sink and I would walk the other way, so I didn't even have to make eye contact with him. I created a Rosie survival playlist and played Katy Perry's Roar on repeat into work. I was armored. I was ready for battle. I would come home and sob at the dinner table. I was so stressed out. Now Peyton's 3. Well, they witnessed, then the stress they're at home, and he starts biting a kid at his Montessori school. I mean, it has a ripple effect. And the icing on the cake, this is Peyton when he was 3, around this time, is my dear sweet Uncle Buford passed away from an aggressive form of brain cancer. And my boss at the time never so much as said, I'm sorry for your loss or anything. And in fact, I was right before I was trying to leave to get out of town for his funeral, I was called into the COO's office with her and my boss at the time. And I was being scolded for not being happy-go-lucky and outgoing. And I just was tired and exhausted, and I had no filter left. And I remember I looked at her, and my boss had one of those portfolios where he had a paper partially slid out, and everything in my spidey sense said, they're going to fire me. And like, with nothing objective, nothing measurable, like this is a joke, right? And as I'm getting scolded by the COO for not being happy and outgoing, and I said, well, what do you expect from me when every time I turn around, he's telling me how much I suck? And then I said, and I'm sorry, but my uncle just died, and I'm trying to get out of town for his funeral. And she got this, oh crap look on her face. And she turned and looked at him and kind of gave this, and he slid that paper back underneath his portfolio. And I went home and told my husband, I'm pretty sure I was about to be fired today, and that Uncle Buford dying is the only reason I wasn't. And then I had a lot of red wine and dark chocolate for dinner. So I did eventually get out of that place, but it has a human toll. And the story wouldn't be good if I left you hanging. So the good news is I actually left and went for a healthcare organization for a while I was writing out my non-compete, which was a human workplace again. But it took me a long time to heal because I was always waiting for the other shoe to drop. Luckily, one of the physicians recommended a specialist to us, and this is Peyton when he was 5. And we were finally able to get a diagnosis for him, and a simple surgery actually cured him. And this is him today as a rambunctious 9-year-old who's in the other room doing his 3rd grade e-learning as we speak. So I tell you this to put a face to the dehumanization. And if any of you have ever been through it and been a victim of a dehumanized workplace like I have, you know how much it sucks. And no one should have to go through that. I don't want Peyton, I don't want our children to have to go through that. And the reality is that there is a growing demand from our human workplaces. Our tolerance for this dehumanization in these toxic work environments is lessening, and it was doing that long before this pandemic. So if you go back to 2017, every year Deloitte does this annual human capital trends report where globally they survey over 10,000 HR people and executives and really kind of look at what's happening in our business world. And back then they were saying that we can't continue to operate with our current paradigms, that we have to shift our thinking. They're basically calling for us to rise to the challenges that the adaptive world, right, adaptive challenges ask of us. And then if you go to 2018, they were seeing a further trend that people are really starting to pay attention to what's our impact on society at large. And what we know is that the future of great workplaces, when you look at the Great Place to Work Institute, it's really about, are we looking at how are we enabling people to fuse their personal and professional lives? And so think about right now when so many people are working remotely, how are we enabling people to fuse their personal and professional lives to allow them to tend to, if they have kids or loved ones at home, and get their work done? And does it have to be from 8 to 4 or 9 to 5, or can it look differently? And if this pandemic has illuminated anything, it's maybe we can be more flexible than we thought. Maybe we can help people find that fusion in a better way. And so I just think that this quote from Peter Drucker is very, very applicable right now, right? Our greatest danger in turbulent times is to try to act with yesterday's logic. We have to reboot, we have to rethink, we have to reset. And that mindset shift that we want to make is first and foremost moving from that inward mindset where we're me focused to an outward mindset. And an outward mindset, instead of me being focused on how everybody else in this pandemic and all this stuff is impacting me, we are turning our lens outward. And we realize that other people have needs and objectives and challenges that are just as valuable, just as relevant, just as important as me. I'm not better or different than anyone else. And so outward mindset, we use this acronym SAM. I see people as human beings. I understand that they have their own things going on. They have their own fears on top of their needs, objectives, and challenges. I get curious about them. I ask them. And then I adjust my efforts to be more helpful. I know a lot of people have been quoting Fred Rogers during this time saying, I look for the helpers. And I know in public health, we're helpers. And so it's how can we turn our lens outward and say, you know, could I go to the store for a neighbor? Could I just simply stay home, right? There's so many things that we can do when we leverage an outward mindset versus digging our heels in and armoring up. And then we measure our impact and see if it's helpful or if we need to readjust our efforts. And this is essential for us to be able to navigate the waters of adaptive change, to navigate the waters of this pandemic, and to really start to have a more human workplace, community, team, etc. And what's really encouraging and really is so exciting for me in my work is if you go back, you know, many, many years ago, more than 15 years ago, there was a research project that was started that was called the Firms of Endearment, which I just love that name. And initially it was 28 organizations that they identified that have what they call a total stakeholder view. They have this humanistic way about going about business where they don't put any one stakeholder above another, right? Everybody is equal. They really have that ultimate outward mindset, if you will, that they recognize that their company culture is really important and they don't leave it to chance like my former employer did. They tend to it, they nurture it, etc. And they invest more in training and development and well-being, and they don't force people to do things, all those types of things. And they keep identifying more and more and more of these firms of endearment, and to date there's 66 that have passed the criteria, if you will, to be one of these. Here's what's exciting about them. These are just some of them, but if you think about these firms of endearment, and many of these are the publicly traded ones or familiar ones, but there's government entities, there's nonprofits, there's a whole host of these organizations that are breaking the mold of business as usual, and they're thriving. Right? I mean, even in the middle of this, where some of them are struggling financially, they're finding ways to do it very humanly and keep their people whole and keep their business whole. And in fact, as they've researched these over the long term, if they just take the publicly traded ones compared to the firms of endearment, they outperform them over a 15-year period by a 14-to-1 ratio. And at the 10-year mark, they were outperforming the S&P 500 by an 8-to-1 margin. So as time goes on, the gap between these conscious human businesses and business as usual is getting bigger and bigger and bigger. But it's counterproductive. And so there's this whole movement, if you're not familiar with it, that has grown out of this. It's a nonprofit movement called conscious capitalism. And conscious capitalism is really the firms of endearment in action. It's a intersection of recognizing we have a higher purpose and that all stakeholders matter, and we need to think about leadership differently, and we pay attention to our culture, and there's chapters that are popping up everywhere. And actually right now they have their national conference going on that's virtual, that has been adapted to be free. And so all of this is so encouraging because as you're seeing the growing movement, and they actually did a firms of endearment research last year in Brazil and found similar results in that global economy. And so I just think that if this COVID pandemic has taught us anything, it's that we really need to and can hit a reset button, that we're not going to go back to quote unquote business as usual, that this current climate we're in is exposing all kinds of organizations at every level to this level of disruption and volatility that is really forcing us to choose between irrelevancy and adaptability. And so the good news that we can take from all this is there is a path forward, and we can counteract this dehumanization with an antidote that helps us not just now, but beyond. And really those organizations that are going to be standing stronger and thriving on the other side of this, leverage these principles in one way, shape, or form. And the visual that I give, and I know there's a handout I think that people are being given, and you can also download this for free on our website. When you think about what do we mean by like a future-proof, thriving organization that allows people to fuse their personal and professional life, we have this visual that we call our thriving organization pyramid that was designed as a discussion starter to really look at where are you in your own organization, in your own team. And when we don't have some of these things at our base, and we're trying to help people with their emotional well-being or their financial well-being or some of the things that are also very important during this time, it's really hard. And so we can look at, if you have a good solid base, how do you nurture that and not let it get away from you and move further up the pyramid? Or if you're trying to affect change up here, but you've got some issues down here and you wonder why they only get you so far, it kind of helps you see where do we need to pay some attention. And so our new book is actually organized by this pyramid, and each chapter takes a deep dive into what does it look like, what are organizations doing, what are some of the exercises that we do with teams that you can use, and then really what are some tips that you can put into place right now to show up as a leader and really influence and lead positive change at each stage of this pyramid. And so what I want to spend the rest of the time today going through with this kind of dehumanization antidote are 5 key rehumanizing principles that we weave throughout the book that are really interconnected and are really beyond just workplaces. Yes, they're essential for workplaces, but we're finding that these principles are almost universal for your families, for your communities, for your teams, and that you can put these into place right now to help navigate the waters we're in and help you be stronger on the other side. And so rehumanizing principle number 1 is build a lighthouse. Think about what a lighthouse does. It cuts through the fog, the VUCA storms, if you will, and it helps provide a sense of calm of I know where to go, I can find my way to it, I can find my way out of the waters, out of the disruption, and have a path forward. And so many of your organizations probably have a very strong mission or vision or purpose, but has it really been articulated in a way that people emotionally connect to and they see how they fit into that? And this is a great opportunity to re-clarify your purpose. Or if you haven't really done that work, this is a great time to look at who is showing up as their best self. And when we are rising to the occasion, what does that look like? Your purpose already exists. It's in there somewhere. How do you illuminate it and bring it to light? And then on an individual level, when people know what their purpose is and know how they can contribute and who they are when they're at their best, again, it provides that beacon of light of I know that there's a path forward, and it helps provide some calm in the midst of this storm and disruption. And what we know from research done by Imperative and others is that when people are fulfilled, they have a purpose mindset, that they know how they fit in to that higher purpose, that they perform better, that they're going to be ambassadors of your brand, that they're going to stay. All of these things that we know are super, super important. And if we want to take it to an individual health level, there's tons and tons of great longitudinal studies on people who report a strong purpose in life having better health outcomes. And so there's many, many reasons why we want to have that lighthouse and have that clarity of purpose, not just on an organizational level, but at a team and an individual level. And it's one thing to have that clarity of purpose, but there's a second part to this of how do you actually then live into that purpose? Because purpose might be a concept or an emotional compass moving forward, but how do you actually ensure that that purpose becomes a reality on a day in, day out basis? And this is where we need to do the work to operationalize our values, so that values aren't just on a website or on a wall from an organization standpoint, that we've actually translated them into clear behavioral anchors. How do we show up when we are at our best? When we are living our purpose, what are the actions that we need to engage in? And on an individual level, what are the actions I need to engage in every day to live my purpose, right? So our organization's purpose is to rehumanize the workplace so that people can bring their best selves to work and home each day. Well, how do we do that? Well, we've done the work to look at these are our behavioral anchors, just as one example. So embrace your humanity. That means that, you know what, we have to strive for excellence, not perfection. And we have to give ourselves and each other grace, because no one is perfect. We are stronger together. That means that we need to recognize that we are hardwired to be in community, that we have to have this abundance mindset rather than a scarcity mindset, right? That we foster and nurture things that build community. And you'll see that in the work we do. We choose courage over comfort, right? We know that it is uncomfortable to challenge the status quo and sit in adaptive challenges, but we must do it. That sound science is our friend, that we're not going to recommend anything that isn't rooted in sound science applicable for human beings, and pave a path for others to thrive. We're not going to say stop doing something if we're not going to say here's what you can do instead. And I will tell you on an individual level, my individual purpose, I've done the work to clarify that. And it's to foster moments of insight for people so they can break past barriers, show up as their best self, and encourage others to do the same, right? Step into their greatness. So I look at that each day and go, if I'm going to do that today, how do I need to behave? I've defined my core values as well as behavioral anchors. This is work we all can be doing right now to help us just ground ourselves and ground our teams and stop some of the swirl that is happening. And one of the ways to do that is through storytelling. It seems really, really simple, but at the start of your team meetings, at the start of one-on-one meetings, even with your families or your friends, tell stories. Say, when have you been inspired lately? When have you seen a great example of our mission and purpose or being realized? Or when have you seen, neighbors showing up, as their best self? And so storytelling illuminates that lighthouse. It keeps that purpose alive. It brings that sense of groundedness, calm, and hope. Do not negate the power of asking people to engage in a new round of storytelling, even if it's just a few minutes. Where are you seeing this realized? Where are you seeing this play out? It really does help people have that emotional connection to why we're doing what we do, especially with the difficult work that public health has right now. Rehumanizing principle number 2 is create fearless environments. Amy Edmondson is the guru of psychological safety, and this is really what this is about, is that when we have fearless organizations or fearless teams, it means that we've minimized that interpersonal fear, that we are creating a safe space for people to show up into that arena where there's uncertainty, risk, and emotional exposure and not armor up, that we're willing to show up and freely share ideas, knowing someone could judge them or could make fun of them, but we're going to share ideas because we need everybody to bring their ideas. We need to rally people's resourcefulness right now. We don't need people holding back. We need people to speak up and say when there's a concern or a risk. We need people to speak up and say, I'm struggling, or I'm scared, or I don't know the answer. Fearless environments create this safe space for this to be done. And in fact, a few years ago, Google embarked on what they called Project Aristotle. And they wanted to look at what was the difference between their high-performing teams and their teams that were struggling. And they identified these 5 characteristics of their highest performing team. And you'll see at the top is psychological safety, that the highest performing teams were vulnerable in front of one another. They took risks. They showed up fully authentic. And the thing is that psychological safety resides at the local team level. So are you creating a psychologically safe or a fearless environment in your family unit, in your work teams, in your divisions, right? We have to create that sense of psychological safety because this is not the time for people to be holding back. And there's kind of this myth, if you will, that fearless environments and psychologically safe, cohesive teams are all unicorns and rainbows. And nothing could be further from the truth. Candor, honesty, transparency, truth are actually expected. So in a psychologically safe team, people would be signing up for unpleasant truths versus I'm going to tell you what you want to hear. It's a comforting lie. That doesn't help anybody right now. There's a lot of discomfort right now. And the best that we can do is to be real, be authentic, and have the tough conversations and speak the hard truths that we need to speak. That's where we get stronger on the other side of any kind of crisis. And that brings us to transformation point number 3, which is wait in the messy middle. Human beings are complex. We are messy. There is not a fast forward button to get to the other side. There's not a fast forward button with this pandemic. There's not a fast forward button with our own growth and development. If there was, man, I would be all for it and I'd be the first in line signing up for it. So when we talk about waiting in the messy middle, it's really understanding that if we're going to show up as leaders, there are really kind of 2 aspects or 2 games of leadership, if you will. There's our inner game, which is our internal beliefs and our assumptions. It's really our mindsets, if you will, that guide our actions. And then the outer game is our knowledge and our experience and our competencies. And both are important, but what do we typically pay attention to? We train and develop people on this outer game. But the reality is that our outer game is run by our inner game. And if we don't tend to this inner game, the outer game can't get stronger. And we usually kind of try to ignore this because it's messy, it's adaptive, we don't know what to do with it. And so if we think about this inner game in terms of what Adams and Anderson call our inner operating system, right? It's our meaning-making system and our beliefs and our self-awareness and all of those types of things and where we get our value and our identity. Think about a computer, right? If you were trying to install an elaborate graphic software program on a computer still running a DOS operating system, think about how well it would work. Probably not so much. The computer might crash. It's going to lose functionality because that operating system can't support that program. Or think about if you were going to try to install an app on a flip phone. Same type of thing. That operating system can't support it. And too often we approach training and growth and development ignoring this inner operating system, and we want to tend to that outer game, but we haven't done anything to upgrade that inner operating system to support the skills, the outer game, right? We're not tending to that adaptive nature of the work that has to be done. And so when we think about this inner operating system, there's kind of two facets that can run our inner operating system. The first is what they call the structure of the reactive mind. And this is what we're seeing happening a lot right now. In our reactive mind, we start with a problem or a threat. I perceive a threat. Here we go. Here's the pandemic. Here's COVID-19. Here's, someone being laid off. Here's fill in the blank. And it invokes this huge sense of fear. And I react. I don't pause. I don't think. Everything then becomes armor, self-protection, because I'm afraid and I'm reacting. And we're seeing this happen in a lot of places, in our government, in businesses, and in individuals. On the other hand, we can upgrade that inner operating system and operate from what's called the creative mind, where it doesn't mean there's still not fear and uncertainty and all the things that are happening, but this is where that lighthouse comes in. There's clarity of purpose and vision. I can see on the other side of this, and that guides my path forward. And yes, there's fear. Yes, there's uncertainty, but you know what? I've got a passion to make a difference and to serve that purpose. And so instead of reactivity, it's thoughtful action. And we are seeing incredible examples of organizations pivot where, you know what, they are anchoring on their purpose and saying, you know what, I have a passion, we can do this differently. And they're getting into action and they're changing their business models and everything, but it's all in service of a very clear purpose. And they're able to do it in a very effective, thoughtful, humane way. And then we're seeing organizations that are digging in, doubling down, maybe laying off people before they need to, furloughing people before they need to, because it's that knee-jerk reactivity of self-preservation rather than looking at what is the greater good with that outward mindset. And so if we are going to navigate the VUCA waters of adaptive change, we have got to be able to shift that inner mindset. We've got to wade in that messy middle, do the uncomfortable work, change our narratives from self-limiting, self-protective to ones that serve us much better. And it's really hard to do that if we don't have a fearless environment and we don't have that clarity of purpose to anchor our ability to operate from our creative mind. And then that leads us to rehumanizing principle number 4, show up as a leader. I already gave our definition of leadership, and really that it is a behavior. It is not a title or a role. And I would say now more than ever, we need every single person in our families, in our communities, in our country, in our organizations to show up as a leader, to be looking at how can I have an outward mindset and make a positive difference? How can I do my own inner work? And how can I call others to greatness? And it's really hard to show up as a leader if we're not doing our own work to wade in the messy middle. Some people have more time on their hands right now and some people have less, but this is a great opportunity to start to really look at ourselves. Do I have clarity of my purpose? What are my self-limiting narratives that I tell myself, and how could I rewrite those stories? Can I move from operating from my ego, which is the filter that we hold on reality when we're in armor and in our reactive mind that leads us to please and perform and perfect and self-protect, and move away from ego and instead move to curiosity, move to abundance, move to an outward mindset, move to our creative mind. And so we can all learn to hit the pause button and go, okay, yes, I had this thought. What else might there be? That when we find ourselves judging, we can instead get really curious and go, I wonder what that person's experience is like. That we can practice empathy and compassion. We have the power to do that and start building those muscles now. And I love this quote from Viktor Frankl, which I think speaks to everything we're experiencing right now, is that when we're no longer able to change a situation, we are challenged to change ourselves. And this is an opportunity for all of us to change ourselves for the better, right? That none of us are going to be the same, and we have an opportunity to grow and be stronger and wiser and more effective, or not. And I hope that it's the former. And then that leads us to the final rehumanizing principle, number 5, which is find your tribe. This is not go find people who are just like you because it helps you feel comfortable. Find your tribe is about building community. And this is the essence of public health, right? We are neurobiologically hardwired to be in connection with each other. And so this is about seeking out people who are different than us, understanding where there's economic disparities and health disparities and what is their experience like. This is the ultimate outward mindset in action, to learn what is it like to be somebody else. And let's start to have a conversation and rally around a common purpose, right, of what could a better future look like and how can we do things differently now. And what has been so incredibly insightful for us over the last few years is that culture and psychological safety ultimately reside at the team level. And that you can, with one conversation, with calling yourself to greatness, rallying people around a common purpose, engaging people in discussion, you can build momentum pretty significantly. It's like grassroots organizing. And that you start to build relationships and have these conversations, and you let that energy grow from there, and you can start to transform your workplace, your teams, your community, etc. And so really everything that goes into building community and nurturing relationships and diverse relationships. And so I started out asking you, imagine you have this magic potion, and what I want to suggest to you is maybe it's not magic, but you do have a potion, so to speak, that dehumanization antidote that we can all look at. Am I clear about my organization's purpose and how I fit in? Am I clear about my own purpose? And can I start engaging people in storytelling and conversations to illuminate that purpose better and really intentionally help people find that alignment and kind of ground themselves and provide calm in the midst of the storm? That we can create fearless environments, right? By choosing to be brave and not armor up, and inviting other people to do the same, to recognize that we need to embrace candor, and we need to just have ideas sharing, and we need to admit when we are struggling, and all of those things that go with it. That we've got to do our own work to be uncomfortable and rewrite our inner narrative and wait in that messy middle, and avoid the temptation to just tend to that outer game and hit the fast forward button. That we all can show up as a leader in our lives and invite other people to do the same, and really have that outward mindset and look at how can I help? How can I have that positive impact? And what do I need to be the best version of myself? Because I can't just be giving and giving and giving and not tend to myself. Like, what do I need? If I don't get good sleep, if I don't spend time with my family, if I don't fill in the blank, I can't show up as a leader. So we've got to recognize both parts of it. And then we got to work on building community. This is our magic potion that can help us not just now, but really be stronger on the other side of this pandemic. And so if I want to really sum this all up, know that rehumanizing our workplaces and communities can be done. It needs to be done. We've got some great examples of this rehumanization revolution already underway with conscious capitalism and firms of endearment. That it doesn't have to start at the C-suite. A lot of times people think, well, you know, I don't have the ability, or I don't have the relationships at that executive suite. And yes, it helps, but it's not a deal breaker. Start with your own team. Start with your own location, right? Think about the grassroots organizing, because here's what we've learned. When you have one group or one team that starts to transform, people start to take notice and they go, well, what'd you do? How do we do that? And you can build momentum, and it doesn't have to be a top-down initiative, right? And we all, especially being as spread out as we are, have an opportunity to really look at things in a different way at that local team level. And that we can use that to build a critical mass, one person, one team, one family at a time. And so the invitation for us to leverage this and to really come out the other side of this better and stronger is moving from trying to control to having compassion, moving from focusing on strategy to really focusing on purpose and letting that guide us, from caring more about participation or hours worked or whatever it is to are we nurturing and fostering fulfillment, to move from that self-protection that is so inherently triggered right now to self-reflection, to move from that guardedness to connectedness, and to move from scarcity to abundance. So my hope for all of you is that with all the work you're doing, that you're thinking about these things and able to put these at play in your family, in your team, in your communities, and really show up as leaders and call others to do the same. And the other good news, and I think Lena's gonna make an announcement, but our publisher, we've partnered with them right now to make the digital version of our book available for free right now. And we are also launching a free virtual book launch or a book club starting next week. So super, super excited for that. So I will turn it back over and we will move to questions.
Thank you so much, Rosie. That was so meaningful. And I've been seeing the comments come in the chat window, and I can tell it was very moving and meaningful to many people. So at this point, we are going to open it up for Q&A. And if you're not as adept on Zoom as Dr. Rosie is, I'll show you how that is. It's an old slide from a former meeting. Or maybe that is, I'm not adept either. Anyways, on the Q&A, there's a Q&A button. If you hover at the very bottom of your screen, just click on that and type your question in, and I will read them to Dr. Rosie, and we'll just keep on going. Okay.
Awesome. And I did see some questions. I know if there's a handout, I will make a PDF of these slides available and send them to you as well, so.
Yep, great.
So, yep.
A question about the free digital book, and yes, I will email the link to all of you with that. So as the questions come in, I'll just start off with one question in my mind. I think the information that you've given is so important, so relevant. And I can see a lot of people saying, I'm going to do this at work, I'm going to do this at work. But then we get home and we crash because we're exhausted from doing it at work. And then unfortunately, our family doesn't always benefit from these. So what experience and advice, words do you have for how we make sure we do this, we rehumanize our families as well, and the stress of the your relationship with your partner, your relationship with your children, that they benefit this as well.
Yeah, I think, the thing that comes to mind and the thing that I keep coming back to and anchoring is that we have to tend to ourselves, right? It's to put on your own oxygen mask before helping others. And that includes self-compassion. Like, we've got to give ourselves permission to feel whatever it is. We've got to give ourselves permission to ask for what we need. If we've been out giving all day long and we need to be able to have those real conversations with our loved ones, with our children, with whatever, about, kind of depending on their age or your significant other or whoever is in your household, about what you're needing. And so that when you think about our definition of leadership, it's why it's twofold. It's becoming our best, fully authentic selves. And here's the thing, is that it's not like a stagnant thing. I will tell you that what I'm finding that I'm needing right now to be my best self and show up as a leader is different than it was 3 weeks ago. Right. And that means, like, if I want to be a leader in my family, if I want to be a good mom, if I want to be a good spouse, like what does that need to look like right now? And so I think it's resetting and just kind of going, what is that? And I think, sometimes we can put so much pressure on ourselves. And I know a lot of people have the mindset of give, but you can't keep giving if you're depleted. And so, like, I've been like sleeping more than I normally do, right? I've been trying to like pace myself more than I normally do. And one of the things that we're also doing as a family is, we're having a conversation of just something simple as saying, what are 3 good things today? Because it can get really easy to get stuck on what's not going well. And so I think it's just giving ourselves compassion, and how are we handling ourselves when we screw up, because we're going to screw up, and how do we show ourselves grace? For those people who are parents, one of the best resources on BreneBrown.com, she has some free printables, and she has what's called the Wholehearted Parenting Manifesto. And we have it hanging as a reminder for my husband and I in our kitchen, but we also have it on our son's wall. And it's really about that I won't show you or teach you anything, but I will allow you to be, or perfectly, but I will allow you to be fully seen, and I will embody it by how I show compassion for myself when I screw up, right? And like, what are we teaching our kids and stuff? So I just think self-compassion and self-care are so critical to be able to show up as a leader. And that's that first part. It's not just maximizing our positive impact. We can't do that if we're depleted.
I love this next question. How do you create a psychologically safe culture when you have staff or even yourself who have no filters and can be abrasive?
I would say if yourself has no filter and you know that, this is a great opportunity to wait in the messy middle, right? To really look at, okay, I know this about myself. How can I start to do some reading, engage with a coach, whatever it might be, to learn to pause, right, more? Because it's really, when we don't have a filter or abrasive, it's usually about pausing and challenging, what's the story I'm telling myself? So what I would say to myself is, like, when I have this judgy, crummy, whatever, it's like, okay, self, like, what's the story I'm telling myself right now, and how else could I tell myself? Depending on whether there's any trust there or not, you could ask that person, hey, and not in a judgmental way, but like, what's the story you're telling yourself right now that is leading to that? Or it could be, you know, can I give you some feedback? Or, you know, can I ask for what I need or whatnot? And here's the thing is that if it's the leader of the team, that's tough because they like the actual people leader, because they do set the tone. But how can you create pockets, not of gossip or of talking about people, where there's safety within your team? And so it depends on how big the team is and kind of who the person is that's abrasive or whatnot. But I think it's, if this pandemic has, one of the gifts I would say that this pandemic has given us is, I think almost everybody is realizing that there's an opportunity to hit the reset button and to say, like, how can we do things differently? And we can say, you know, maybe we went XYZ, but you know what, can we just have a conversation? And this is a huge opportunity for us to reset and reboot. How do we want to work together, right? So maybe even rally it around that lighthouse or that common vision and purpose of how do we want our team to work together? And then it takes it off of that personal attack and gets people focused on a common vision. That can also help too.
These next couple questions, it's a really great segue into what you were just talking about. And these people are recognizing that this is really a paradigm shift. And so the question is, what are the best first steps, if we look at this as a paradigm shift, to getting our agency, our coworkers, our workplace leadership to adopt some of these principles and move towards that paradigm shift?
Yep. So paradigms don't change easily. One of the stories that we tell actually in both of our books is, many of you might be familiar with it, but like the story of Galileo, right? That he wasn't the first person back in the day to suggest that the Earth wasn't the center of the universe, but he invented the telescope, right? Improved it. And it was so threatening to the paradigm of that time that he was sentenced to live out his life in house arrest, and many people wouldn't even look through the telescope. And so we need to recognize that paradigms help provide a sense of familiarity and comfort, and it's really unsettling when our paradigms are challenged. And so the last thing we want to do when trying to shift paradigms is trying to shove something down somebody's throat or make them feel wrong, right? So this is where rehumanizing principle number 5 comes in, find your tribe, right? You start by having a conversation with someone of like, wouldn't it be amazing if we could use this opportunity to like reset and do something different? Or you could go, you know, I listened to this webinar, I would love to get your thoughts on it. Or send them a link to something. We have a whole bunch of free links and stuff on our website, or maybe you read a different blog, or maybe it's a Brene Brown podcast or somebody else's podcast. So I always say you start by building relationships, because think about, when you know somebody, you're more willing to engage in a discussion and you build from there. So I think there can be this tendency of, oh my God, we got to overhaul everything right now. But start where it feels manageable, pilot something, have conversations, and then do something with a team, and know that paradigms don't change easily, but it takes patience and it takes persistence. So maybe it's a, hey, I'm going to send you this email. Here's a link. Hey, here's a blog. Hey, here's this. And you're planting seeds and then engaging people in a conversation. What my hope is that the jolt that COVID-19 has brought us might expedite people's willingness to engage in some of those conversations, where maybe when things are, you know, hunky-dory, status quo, it's not seen as much of a need. And so it's possible that there might be more of an appetite for for conversations of doing things differently, just because of what's going on in our world and in our environment.
Great. Great first steps in ongoing work. This person is asking, and probably a question, and it sounds like something you encountered at your previous workplace. So they've done these, they follow the steps, they're trying to do those nudges to get people there, and it's just not working. So then what? What do you do when the supervisor gives you the old smile and nod, and then it's business as usual or even worse?
Yeah. So there's a lot that goes into that. And I think in our book, we have a section that our publisher asked me to put in that is called, should I stay or should I go? Right. And here's, I think there's no easy answer. I look at it as, if I feel like there's any glimmer of hope, right? Where like, maybe it's not my direct supervisor, but I have some coworkers where I can influence and lead positive change, or there's, not to go over their head, but there's someone else in another area. Like if you feel like you can make a positive difference, and keep in mind, it takes time. So like if you have a supervisor who's clamping down and doing old school, it's because it's what's familiar and it's what's comfortable. So it's, how can you make something different not feel threatening to that person, not feel too unsettling, right? And it's planting seeds. Think about it like you're planting a bulb in the fall, knowing that it's going to hopefully turn into a flower in the spring. If you feel like you've pulled out every stop of trying to show up as a leader and influence positive change and have patience, and you can't get anywhere and it's toxic, the reality is that it might be time to go. And that threshold is going to be different for everyone. But I feel like if you feel like there's opportunity, and maybe there's just this one person or these other things that aren't getting the traction you'd like, maybe you still want to kind of keep at it. So, and again, if not, I mean, like with me, it was like I had to go. Like it was beyond clear I had to go. It was not healthy. So everyone's got to kind of make that own discernment for themselves depending on their situation.
And so if you realize that it's time for you to make that leap and make that move, and you're in a space that you can do that, how do you find a quality company or organization or agency? What are the signs that you want to look for when you're seeking out a new place? You put up the slide of all those companies, those more Fortune 500 companies that meet the humanistic guidelines. But I'm wondering, smaller organizations, governmental, we're public health, we work for government agencies, we work for nonprofits and associations. What advice do you have on kind of what are those instead of red flags, those rainbow flags or whatever color flag we want to use for the sparkle flags for a humanistic work?
Sparkle, I like sparkle. It is my favorite color. So yes, sparkle flags. I think, there's a couple things. So one, I mean, the slide I put up had like many of the Fortune 500, but here's the thing, the conscious capitalism movement is growing and growing and growing. And there are small companies, there are a lot of nonprofits. So I would say if you go to consciouscapitalism.org and then you can look for like local communities, and they have like this credo that people sign. And so you can start to get a sense of kind of who might be around. I don't know if there's a chapter in Iowa. I don't know. There might be, but maybe in some of the surrounding communities. But that would be one thought. The other thing is, I mean, you ask around. And so like some of the, you start looking on LinkedIn, you start looking at, doing, honestly, go to Google searches and what are people saying about, this team or whatnot, and you talk to people. But I would say, like, if you're just looking for like sparkle indicators, are people, do they seem legitimately happy? Do you get a sense, whether it's on their website or any interaction you're having with them, that they're actually living humanistic values? Like, for example, do they follow up and stuff, and are they clear in their hiring process, or do you go into an abyss? Are you forced to do a video recording rather than getting to interview with a live person, right? I mean, there are just some things that kind of listening to your gut and your intuition of, does this feel good? Does this feel supportive, or does this feel kind of, and I think a lot of times we start to ignore that inner voice that we have that can tell us so much. And I think it's, if you get to the interview process, I mean, I ask, because I've been through it, I ask questions about, how do they describe their culture and how do they treat people? And I asked before we started our own company, I would ask to interview other team members, because I could tell if they were putting on the, I'm supposed to say this in the interview, versus, if it was real and authentic. And you can just start to get a feel, right, for the vibe, if you will, whether it's a virtual environment or in person, you can get a feel. Do people connect as a human being, or is it jump to task? Do they feel very, stifled, or is there open dialogue? So those are some of the things that I would look for.
Mm-hmm. This next question is, I applaud the person who sent it in, because it's a very vulnerable question. If you're doing the work and you're being insightful and trying to kind of rehumanize yourself, so to speak, and then you realize that you are actually the problem, or part of the problem of the workplace. How do you acknowledge that, apologize, work to build trust so that you can move on and improve?
Yeah. So, kudos to whoever sent that in. And here's what I would say is, first of all, congratulate yourself on being human, because everybody does it. I think my greatest lessons that I've learned as a human being and as a leader are when I've just completely screwed up, right? And when I've had blind spots or shown up as a butthead, and somebody, thank God, had enough sense to call me on my crap, right? And so I think that you will do wonders to literally say to your team, I've been thinking, or I've been doing some self-reflective work, or whatever you want to say, and you literally say, and you know what, I realize I have not been showing up well, and this is what I'm seeing. And first and foremost, like, I want to apologize to you for that. And I'm realizing this is a huge growth opportunity, and I want to work to be better. And so I'm just here to apologize and want you to know this is what I'm working on. And maybe there's a request, like, if you see me do XYZ, like, I want you to call me on it, or like, this is what I'm going to try to do. And you keep being very clear about your intention. And depending on, some people might sit back, depending on what your relationship is like with them, and go, what the heck? And what's with this person? And yeah, I'll believe it when I see it. But usually, and this is our fear being vulnerable, that when we take off our masks and armor, the natural reaction is empathy and compassion. And the biggest thing you can do to build trust as a leader is to be vulnerable and to say, I'm sorry and I messed up. And so that will go wonders and put you a long way in kind of moving a path forward by just choosing to take off your own armor, own it, apologize, and then start to take the steps. That isn't an overnight fix, but with that consistency over time. And you'd be surprised right now. I think we think it takes a long time, but the natural response is empathy. The natural response to armor is more armor and defensiveness. The natural response to vulnerability is empathy and compassion.
Great. I think that's a great example. And it reminds me of a time, a leader that I always think back to and reflect on. And she's one of those people that if she called today, I would, get in my car and go. We had a really difficult time at work, and it was a political decision that was not in our favor whatsoever. And the next day she showed up, and she was the leader of a large health department. And the next day she showed up in our cubicleville with her jeans and sweatshirt, and you could tell she hadn't slept well the night before. And she said, I just want to be with you guys today. Can I hang out with you? And I just remember that as such a vulnerable, courageous leadership movement that she made. And obviously 20 some plus years later, it still has an impression on me.
Yeah.
So I want to thank you. We're about 10 minutes left. We're scheduled to go until 1:30. If you have if there are questions that you want to ask, still go ahead and we'll try to sneak those in. But I do want to take the time right now to thank everybody for being here, to thank Dr. Rosie for sharing her work and her insight, to thank all of you that are still online and still engaging with us. There's a question about the presentation being recorded. It is being recorded. It will be posted on the IPHA YouTube channel that you can share. So you can share it with your colleagues, with your supervisors, with your partners, with your children, and you share it wide, please. So thank you. This has been a wonderful 90 minutes. Dr. Rosie, I look forward to welcoming you to Des Moines in October. For those of you who don't know, Dr. Rosie will be here with us in October to lead a Dare to Lead workshop for us. It is already sold out, so those of you who will be there with us, I'm looking forward to seeing you. Those of you who missed out on the registration, make enough noise and maybe we can do it again. So I do encourage all of you to get a copy of Dr. Rosie's book. I will be joining the book club, and I hope you will too. I'm going to try one more time to share my screen here. We have a couple more slides to show. Is it working?
Yeah.
Okay, great. It's just on my big monitor here. So this was the how you get to the Q&A. See, this is me not knowing how to work my computer. Anyways, the next thing we have coming up is, this is, as I said, the kickoff to the virtual conference. And so starting tomorrow right away, we do have new breakout sessions. There we go. We have breakout sessions from all of our speakers who are going to be doing breakout sessions of the lessons learned and best practices from around the state. Many of them, about 30 people, will, over the course of the next 2.5 weeks, will be presenting their work virtually. So you don't have to miss out on the breakout sessions just because we weren't able to meet in person. So the mission of Iowa Public Health Association is to unite and strengthen the voice for public health in Iowa, and we are still doing that. We are doing that virtually. We are a network together. And we are supporting each other through this. So if you enjoyed today's session, I do encourage you to consider joining Iowa Public Health Association. I do have to put in a little plug for our organization and Iowa Environmental Health Association as well. We're both membership organizations, and we work very hard to put on this conference for you, to bring Dr. Rosie here virtually to speak with us all today. So if you've been inspired and want to do more to help us unite and strengthen the voice for public health in Iowa, I do encourage you to consider joining our organization. And with that, I will say thank you again to Dr. Rosie. I will say thank you to our sponsors, to College Public Health, to Unity Point Health, AmeriGroup, and Aetna, who sponsor the entire conference. And I welcome everybody to join us every day at noon for the breakout sessions that are coming up. So with that, I say thank you, and I wish you all well and stay vulnerable and courageous.
Thanks for having me.
Thank
Bye.
you.